also the former African Union Goodwill Ambassador on ending child marriage. Through her work with the African Union and SADC and the traditional leaders, and her proximity allowed civil society organizations and young people themselves to be able to engage with traditional leaders and religious leaders and governments themselves on the issues that young people face themselves and in the communities through Nangas, a safe space where young people, mostly young women, can speak freely about their issues. And lastly, I want to acknowledge the now late former president of Zambia, Edgar Lungu, who was the champion of the African Union campaign on ending child marriage. May his soul rest in peace. So with all these issues that I've highlighted and what we see on the ground, as an organization, we also, and constituency, we try to educate young people through comprehensive sexuality education and other programs, and conduct health outreaches to make sure that we bridge the gap in knowledge and access to health services. We also provide safe spaces for young people to converge and converse around those issues, and also be empowered and empower each other and build their capacity around the issues that affect them, and also give them access to platforms where they speak and represent their peers on issues that affect them. For now, I would like to end here. Thank you very much.
Thank you so much, Tebogo. Thank you for raising those very, very good examples of what is happening that sets the benchmark for positive action in this regard. This is a good point for us to reintroduce Evans Walufu, who will formally welcome you. Thanks, and over to you, Evans.
All right, thanks so much. I'm called Walufu Evans. I hope I'm clear. And I am the executive director of Casey Foundation, as well as the founder. So I am honored to welcome you all on this session. Today's session addresses the pressing issues affecting millions of girls in Africa. Child marriage violates human rights and blocks progress on global goals like no poverty, which is SDG 1, SDG 3, health and good well-being, SDG 4, no education, gender equality, SDG 5. So at Kate Foundation, we have seen and witnessed how poverty and poor health systems push families to early marriages. We recently conducted a study in Uganda on child marriages and teenage pregnancies, and all what is going to be addressed on this session were highlighted in that study. So marriages to girls mean lost education, poor health outcomes, and the intergenerational poverty. So this session is a space to participate. Your questions and the perspectives are valued. Thank you so much to all attendants and for Dr. Munyi. Thank you so much.
Thank you very much, Walufu, and thank you for the official introduction and official welcome. Now that we've heard very candid reports around what is happening on the continent in this regard, what is left for me to do is really talk about the health issues that child marriages force us to reckon with, and early motherhood. So child marriage does remain one of the most damaging practices affecting adolescent girls and young women, and particularly in low and middle income countries. And we're talking about the age of 18 and younger, often, as we've heard, due to poverty, lack of education, or social pressures. These young women are thrust into adulthood way before their bodies and their minds are ready for that kind of pressure. And what this does is it increases their vulnerability to early pregnancies, which in itself carries higher risks of perinatal, obstetric, neonatal complications, as well as maternal mortality. And as you know, in sub-Saharan Africa, we have been in the last 20 years dealing with significant and preventable causes of maternal mortality. The WHO says that in 2021, complications from pregnancy and childbirth are the leading cause of death in this age group, 15 to 19 years globally. And much of that burden of disease is lying in low and middle income countries, which I assume most of our audience is from today. Child brides are therefore more likely to experience gender-based violence because of this lack of agency, and they have limited access to reproductive health care. As a specialist in public health medicine, and I'm based in South Africa, I can tell you that the failure of our health systems to care for young women and adolescent girls is a serious concern. And the longer we allow the failure of our health systems to provide for access to care, and when I talk about access to care, I'm talking about 4 dimensions of access, which is geographical access. That means distance to health facilities have got to be close enough. Then there's also availability of access. So having a health facility that is only part-time and not available is not sufficient. Services should be affordable. If we have situations where we have healthcare services that are expensive and people have to pay for them, that inhibits access as well. And then it has to be culturally acceptable. So for instance, if you have a health system that is, or health service that is not catering to the local population, the services rendered there are not addressing the needs, that's also a kind of detriment towards adequate healthcare access. So the state of adolescent health for women in low and middle income countries is not ideal. These young women and adolescent girls face unique health challenges, early pregnancy, as we said, but there's also the issue of menstrual hygiene and insecurity around that. There's malnutrition, there's exposure to gender-based violence and all forms of discrimination. Those of you who practice in South Africa will know that in South Africa and in other Southeast Asian countries as well, there is the concept of obstetric violence as well, which these young women are very, very susceptible towards. They're vulnerable to a form of violence and discrimination against them, even during the perinatal and peripartum stage. In 2022, UNICEF reported that about 30%, 1/3 of all adolescent girls in sub-Saharan Africa cannot access healthcare services that they need. In Asia, also about 30% of girls are underweight, for instance. 40% of young girls facing anemia because of poor nutrition and lack of access to adequate nutrition. All these things result in long-term consequences for reproductive health. It does not stop at reproductive health. It also leads to a limited ability for cognitive development, and therefore limited ability to contribute to economic activities in the country. So if we want to build the nation, in other words, we have to ensure that our young women and adolescent girls are having access to good quality healthcare. Healthcare access, however, is a barrier in a lot of countries. The health systems there are often under-resourced, overstretched. The barriers to access are very great. And as we said, access is multidimensional. It's not just about physical distance to the health facility. The Lancet Global Health, that journal article emphasized that adolescent-friendly services, they actually facilitate good care, good quality care. And when there are unmet needs, for instance, for contraception, which is really attached to stigma in many cases, that also provides barriers to accessing care. I have seen in my own exposure in South Africa in various clinics and hospitals around the country, where many young women face a lot of stigma when they seek contraception, family planning methods in their clinics. Many times they come from small communities, and visiting a clinic for contraception and family planning may be exposing you to family punishment or some kind of community ridicule, gossip, that kind of thing. So many times we find that if we are not going to take responsibility and in the health system build specific intention to increase access to quality health services for adolescent girls and young women, we are going to find a vicious cycle of poverty and maternal mortality. But poverty in itself is both a cause and the consequence of poor adolescent health in girls, particularly in girls. And girls in low-income households, they're more likely to experience malnutrition. I think you know already, in terms of order and social hierarchies in the family, women are given less preference in terms of education often. And although it may surprise people to know in 2025 that this happens in some sectors of our societies and communities. School dropouts many times are linked to poor health outcomes as well. In 2020, the World Bank did a study of adolescent pregnancies, and they found that a woman who is pregnant or experiences early motherhood, that is before the age of 18, she has a chance of losing 30% of all lifetime earnings. And that in itself can perpetuate an intergenerational cycle of poverty. How does one climb out of a cycle of poverty when your earning capacity is severely limited before the age of 18? So when adolescent girls and young women are denied access to health, there are knock-on effects on education, social protections, and communities, and definitely nation building, because you cannot have a nation and build the nation when the mothers are not secure, healthy, productive. So there is a bigger picture here, and that bigger picture is of the social determinants of health. Remember, healthcare is one aspect of health access. The health of adolescent girls cannot be isolated from the broader context in which we live, and perhaps we have more control in the broader social determinants of health. Here, there are pervasive gender norms, discrimination, stigma, violence, a lack of political voice on behalf of women and young girls. And all of these things help to shape health outcomes. Like I said, I think this is where we have most control. We as catalysts in our various communities and various quarters that we are in, we can change things by changing restrictive cultural attitudes, for instance, around menstruation, around women who struggle in silence with all of the normal routine changes in a woman's life from the time of reproductive age. In many low and middle income countries, adolescent girls are systematically excluded from decision making. And this lack of agency means that they cannot speak up even when there is a need for health on their own behalf. I'm not going to talk about gender-based violence because I think everybody here is aware. But let me say this, that UN Women found that nearly 1 in 4 adolescent women in low and middle income countries has experienced or will experience some form of physical or sexual violence. And I suppose the most concerning thing here is that this physical violence is coming from a known intimate partner. So this intimate partner violence is definitely something we're familiar with in South Africa, but it is it bears a huge consequence, including not only physical trauma, but mental trauma as well, post-traumatic stress disorder arising from it. Not to mention STIs, sexually transmitted diseases, unwanted pregnancies, and depression, among other issues. So what's the call to action? The health of adolescent girls is not just about a woman's issue. It is about a health issue. It's about a societal issue. It's an economic and moral imperative. What more can be done? Let's talk about the health risks to the mother. As you know, if the younger you are, as a young mother, you face quite a direct health risk during your pregnancy. And we find, often underprepared for childbirth. Their bodies are still developing, so they are not absolutely ready for the massive changes that happen during pregnancy on their physiological systems. And so often there's a lot of obstetric complications that young girls can experience. If you're looking at a pregnancy that happens between 10 to 14 years old, and as much as I don't want to even consider or even think about that, but they are 5 times more likely to die in pregnancy than a woman in her 20s, for instance. It may be a very clear, but just it bears repeating here. Preeclampsia and eclampsia, this is a state of pregnancy that is associated with high blood pressure to the extent where you may even have seizures. And here you can have death to the baby as well as death to the mother. You can have obstructed labor because of an underdeveloped pelvis from the mom. And that obstructed labor can lead to things like cerebral palsy in the baby, which is a lifelong condition resulting in severe disability. You can have something called postpartum hemorrhage, which is the failure of the uterus to contract and stop bleeding after delivery. Again, this can be fatal. It's one of the commonest causes of maternal mortality in the world. And of course, infections. A person who is unable to have agency is definitely not going to be able to seek out healthcare when they need it. So the health or negative health consequences of early motherhood does not stop with the mother. It also has knock-on effects on the baby. For instance, children who are born to early mothers are often low birth weight. They're often born preterm because of nutritional deficiencies. And of course, examples are a placental underdevelopment. So the placenta is underdeveloped in a younger woman, a younger girl. And then, of course, there's this increased chance of neonatal and infant mortality when the mother is unable or does not know how to care adequately for the baby. Okay, so in view of time, I'm just going to close by saying there is a call to action for us. We have to do something about the situation. From a health perspective, we definitely need to invest in adolescent-friendly health services. We need to scale up comprehensive education around sexual initiation, contraception, family planning, and again, avoiding child marriages. That must be culturally and as well as age appropriate. We have to empower our girls through education. We have to address this social norms and gender inequality that we see. And one of the tools we can use is digital and data technology. Those data and digital technology, like apps on the phone, where we can send information to children, to young women and children and adolescent girls. These are important tools that we can start to use. And of course, if we build strong institutions that can care for our young girls and adolescents, we can ensure that there's fewer adverse consequences on health. I'm going to stop there. Thank you. And I will be waiting to take your call, your questions after this. But now we move on to Hadir. Hadir, please, will you introduce yourself? Thank you.
Thank you so much, Dr. Cooney, and thanks for all the organizers at Stellenbosch and the African Center for Health Management. I'm really, really honored and glad to be here on this webinar and speaking along with Dr. Cooney with her amazing insights on the medical perspective and the health, the public health perspective also on child marriage, and of course with Tableau from who shared like her very community-based insights, which is very much needed, especially when we talk about something as critical and sensitive as child marriage. My name is Hadir Meher, and I am a researcher at heart, as I always like to introduce myself, and I'm a practitioner at second. I've worked in the field of human trafficking and migration for the past 14 years in different parts in Africa. I'm originally from Egypt, but my heart belongs to Kenya because I've lived there for a long time, and I'm very honored to call that place a home. And again, I'm very thankful to be here today, and I would love to share with you some of the slides that I just like briefly prepared to make sure that we talk about this topic more. And I'm very happy to be receiving any questions once I'm done. So let me try, and hopefully I don't have any technical difficulties as I share my screen. Okay, that seems easy. As I said, usually child marriage I mean, it's very important when we talk about child marriage to talk about poverty and to talk about the health consequences. But what I'm going to pertain to today is also how child marriage is being linked to human trafficking. And human trafficking is, as Dr. Cooney has said, is very linked to poverty, and poverty is a cause and a consequence. So there is some very important definitions as we start talking about the child marriage. So as being mentioned on the Convention on the Rights of the Child, which is an international convention, in Article 1, it says child marriage includes any legal or customary union involving a boy or a girl below the age of 18. And I think this is very important, as Tableau said, because usually we think about child marriage as like something that only happens to girls and young girls, but unfortunately, it's something also that happens to young boys, which I have seen during my research in Uganda. And unfortunately, it's very untold and very much unspoken about because of all the cultural stigma. But let's move to the second definition, which is being mentioned in the Universal Declaration of the Human Rights, Article 16.1, which says that the human rights, the universal human rights provides that men and women of full age have the right to marry, and that marriage shall be entered into only with the free and full consent of the intending spouses. So I think from definition 1 and definition 2, we agree that there is a huge component, which is consent. In the third definition, which is the Convention on the Elimination of All Forms of Discrimination Against Women, the CEDAW, which is a very, very important and very highly spoken of convention when it comes to the rights of women. It says that it further provides that the marriage of a child shall have no legal effect and all necessary action, including legislation, shall be taken to specify a minimum age for marriage and to make the registration of marriages in an official registry compulsory. And this is very important because, unfortunately, most of the time we have marriages that is being that happens on, as we say, like below the table, and it's not legal, and it does not have any legal documents, which happens in a lot of countries in North Africa, as Egypt, by the way. And it's a very customary it's a very customary man-to-man agreement that their child shall be marrying a much older spouse, and unfortunately, it has some cultural and religious affiliation to it, which we'll get to later. These are some very, very important numbers, and I'm going to really get to them really quickly. So all over the world, there is over 1 billion case of registered young girl being married into child marriage. But and mostly it happens in sub-Saharan Africa, and then South Asia and Latin Caribbean. Child marriage prevalence, especially in MENA region, is very, very prominent. And as I said, like Egypt in North Africa, Morocco, and sometimes Tunisia. But in the AU report, the African Union report, which was issued in 2020, it says that 30 out of 41 countries that are registered in the African Union have a child marriage prevalence of 30%. And UNICEF says that there is 60 million women in West and Central Africa have experienced child marriage. UNICEF also says that 130 women and girls in Africa are married before the age of 18. Bear with me the numbers. 40% of the girls in Ethiopia are married before 18 and 14% before they turn 15. I want to jump to the one that says here below, 4 in 10 girls are married before age 18 in West and Central Africa, and 1 in 8 before age 15. And this is very important because usually child marriage is being differentiated in most of the organizations that work on elimination of child marriage. It's usually differentiated that there are children who are married before the age of 15, and others as children who are married before the age of 18. And that is, again, because of the legal and because of the universal accommodation to what constitutes a child. 17% girls aged 15 to 17 are married in rural Upper Egypt, as per unofficial figures, compared to the official national rate of under 2%. This is Save the Children. And in rural Upper Egypt is mostly stricken by poverty rather than other parts in Egypt. And then at the end, 9 out of 10 countries with the highest global prevalence of child marriage, such as Niger, Chad, and Mali, are currently facing the humanitarian crisis, which also gets to talk about like how much families gets to sell or jeopardize their girls' safety into child marriage. But then again, if I'm allowed to say that there's a lot of data, as I've just mentioned in the couple slides previously, we have data from Save the Children, we have data from UNICEF, we have data from Girls Not Brides, we have data from the African Union. And there's a lot of data. And unfortunately, as someone who has worked on in very, very highly risk-stricken conflict zones in Africa and in Southeast Asia, and also someone who is worked as a practitioner, as I started the African Alliance for Community Resilience, an NGO that is working on decolonizing anti-human trafficking practices on the African borders. I am very comfortably able to say that the data does not make sense. And the data does not make sense because, unfortunately, every other organization gets to collect data that might not pertain to the real issue and might be taken by some general understanding of what constitutes a child marriage and not the cultural and nuances of it. So why, as me myself, had very hard time compiling data around child marriage is because there is a lot of families who told me that this is not considered a human trafficking issue or not even considered a social issue. This is just how their societies get to do their work. This is how just societies work. This is the ecosystem, the environmental and natural basis of what constitutes their cultural bonding. So a girl, once she is 16, she's very allowed to get married. Another thing is the clan systems and traditions, which is unfortunately happening in a lot of parts in East Africa, and I have seen in Somalia and Djibouti, for instance. So like when certain clan members have like a prior agreement on how couple of families will have to make some kind of an arrangement, and it necessitates how like their child once she is 15 or 16 gets to marry their from the other family. And at that point, it also has to do with boys being involved in child trafficking, in child marriage, because again, we're talking about 15 to 16 or 15 to 17 years age. And there's already a cultural agreement on how they should get married, and they have no consent whatsoever. The number 3 reason why data is being very hard to collect is there is huge distrust in civil society organizations or the international bodies, because most of the time there is a very adamant acceptance on how certain Western organizations operate in certain African countries, and how that also makes a conundrum in terms of collecting data, because usually families, especially families with very high profile within their societies, even though they have their child getting married at an early age, but they will have very hard time speaking to a reporter or speaking to someone that they cannot trust, or someone like as a foreigner, or someone is an foreigner to their own community. And I don't mean foreigner by being like Western, but like I mean foreigner to their own community, and speak about what is child marriage and how it happens in their communities. So they shut down before even having a channel to talk about what is actually happening. And number 4 is the religious marriages, which, as I said earlier, does not require any civil registration or any legal paper. And even though it is unfortunately very widespread, especially here in Egypt, but it's also is very justified, unfortunately, by a lot of the society members and the community, especially in Upper Egypt, because of A, poverty, or B, because it's the cultural norm, or C, because there is it does no harm. They see that as long as the girl has got her like she has passed the age of 14, then she can get married. But when does child marriage actually becomes a human trafficking issue? And again, I'm sorry that I'm using a lot of international conventions and international bodies, but that's because if we're talking legally, and if we're talking also in terms of like how a civil society reacts, we need to like be to pertain to these conventions. But like the Palermo Protocol, which is one of the most important protocols that talked about human trafficking, it says that human trafficking is the recruitment, transportation, transfer, harboring, or receipt of person for the purpose of exploitation. And again, that matches what we have said earlier on the Universal Declaration of Human Rights, which is there is no consent whatsoever for the children. When does a child marriage is considered a trafficking issue? Again, if there is money involved, if there is if the man is paying off a certain amount, huge amount of money or goods for the family. If the child does not have any consent whatsoever, and I've seen some cases, like in Kenya, for instance, unfortunately, when there is, I was working in Kisumu and in Homa Bay, and unfortunately, there was a lot of, in 2016, 2017, there was a very high number of rape cases. And I was involved in the mediation of those rape cases when like two families, the families sit together. And unfortunately, it ends up by the rapist like marrying off the woman that he sexually abused. And that is considered a better arrangement to child marriage than anything else. And of course, if the child marriage, and this is very interesting, that if the child marriage is considered a cover for forced labor or sexual exploitation, because a lot of women gets married to and they find themselves either like traveling with their spouses or working as in any form of forced labor, like domestic servitude, for instance. And or if they have to do with sex trafficking, which I have seen that in many cases in India and Nepal, where the man jeopardizes his spouse's or the girl's safety to being a victim of sex trafficking. Unfortunately, because of the fragmented legal system that we have in different parts in Africa, that's why sometimes child marriage is just considered like a family matter or a customary practice or a cultural issue, or because there is lack of legal accountability or legislation accountability that actually makes a human trafficking issue a human trafficking, and thus a child marriage issue a child marriage. Again, I know, like, I mean, me as an Egyptian, I've been talked a lot about like how certain summer marriages happen in Egypt, and because Egypt is by large a Muslim country, so usually the conversation on religion comes on the table. And I'm not a very like diligent religious person to speak about like the religious aspect, and I'm not here to do that. But then from what I have seen in different communities, unfortunately, religion is not concerned with all the child marriages cases that I have seen. I've seen Hindus marrying their children into child marriages. I've seen Christians marrying their children into child marriages. I've seen Muslims marrying their children into child marriages. But I also know that there has been a lot of Islamic allegations on how, like in Egypt, there are like the summer marriages, and summer marriages mean like a rich man coming and having a short visit in Egypt, and they want like a company, a female company, and unfortunately they would go to some of the rural Upper Egypt villages, and they just marry off the woman, and they would agree on the term on how long it should like the marriage should be, and there is not even divorce that can happen. Like it's just like a marriage for fun. It's literally called that in like in literal translation in Arabic. And as I said, in Kenya, the rape mediations often end, unfortunately, with forced marriages. And as also I said, like in Somalia and Nigeria, like, no, sorry, I haven't pertained to that, but like part of what I've been doing in Somalia, for instance, was working with child victims of child soldier recruitment and sex trafficking in Somalia by Al-Shabaab. And unfortunately, some of them, like they abduct the boys for being child soldiers, and they abduct the girls for being their spouses. In Nigeria, it happened also because of Boko Haram, who I think it's like the Western African arm of Al-Shabaab and Al-Qaeda in the west of Africa. And there's also another case that I have not mentioned here, but like for instance in Mauritania till now there's dead bondage, and dead bondage means that a slave that has been born in a family, like all their extended family, by practice are also slaves for the family that they work for. So it's a dead bondage that like lasts for years, and that's why a lot of the considerations when we talk about human trafficking, we also pertain to modern slavery, because that's exactly why there's still like slavery-like circumstances that we live in. But in Mauritania, for instance, so if a woman can actually get married to the family that they have been serving, and as part of the dead bondage. I think that like I'm just being so mindful of time. Okay. I'll go real fast. So the intersectional circumstances of the child marriage, and as Deblo thankfully mentioned, there's the climate change, there's the conflicts, as what's happening in Sudan, there's the food insecurity also, as what's happening in Congo. And unfortunately, we find those cases exacerbate what child marriage necessitates. It's not necessarily I mean, they don't know if this is like a human trafficking or not. Even us as researchers in the human trafficking field, it's really, really hard to get to the core of these cases, because again, like there's conflict, there's drought, there's like proxy wars, as what's happening in Sudan. So like it's really, really hard to get to the core or the symptom of child marriage. So I wouldn't say it's only poverty, but I would say that these intersectional circumstances also like are very important to take into consideration when speaking of child marriage. Okay, so how is the humanitarian and the civil society response to child marriage is happening in Africa? So there are three main components. One is the protection and safe spaces, which is usually happening by the humanitarian actors, which is something that happens on the spot as being like a fast response. And there's the education as a prevention and awareness, which sometimes is on the threshold of the work that the civil society organizations and the international NGOs are doing on fields. And of course, there's the legal aid and advocacy, which is usually or preferably is the work and the mandate of the regional bodies as the African Union. But there's a lot of work has been done in that favor, such as a lot of like integrating the dangers of child marriage within educational curriculum, as UNICEF and the UNHCR always do in terms of like their education campaigns. There's also the safe housing for at-risk girls, which is something that we have done in African Alliance for Community Resilience. We've done one in Wajir in Kenya. And there's also the birth registration campaign, which I know has been a very, very important campaign happening here in Egypt in order to have a legal mandate for every family to register their child, so that they do not have to play around their child's age when they have to get to marry them off. Education as prevention, of course, there's the Girls Not Brides. I think it's one of the most important foundations that work on this, as well as the KT Foundation, of course. The local CSOs that do a lot of like community dialogue with the tribal leaders and doing it on radio, using social media. And there is one that's unfortunately in international development, there's a lot of controversy about, which is the conditional cash transfer, which is it's considered like a band-aid solution for some of the poverty-stricken families who have to sell their kids to child marriages. And last but not least, but like the legal aid and advocacy, and usually this happens when we center the survivor and during the campaigns, and if we also have more advocacy on the Sustainable Development Goals, of course, when we mention the gender equality and the child rights for education and healthcare, and of course the legal empowerment programs which help take some legal action against families that jeopardize their kids' safety. This is some like the key legal efforts by some African states that I have done like some research about, and again, like the Convention of the Child Rights, the Sustainable Development Goals, the Palermo Protocol, and of course there's a lot that is also led by a lot of African countries, like the African Charter on the Rights and Welfare of the Child, the Maputo Protocol, which happened in 2003. Unfortunately, we don't get to mention a lot of it, but it is very, very, very well written. And I think that there is also like a very important conversation again when we talk about these issues, is because like there's a lot. I mean, I try to do that in only like 10 minutes. I even went over time, but like I really try to take into consideration that the poverty and health issues that Diblo and Dr. Pooney has spoken about are very intricate circumstances to child marriage, and how sometimes we take a look at it from very afar. We don't know how it's happening, but then it just happens. So thank you all for listening, and thanks Dr. Pooney and Walufo, and thanks all.
Thank you so much, Hadia. It was very interesting to listen to. I think we all recognize it is a wicked problem involving all sectors of society. It cannot be a siloed approach. So at this time, I'm going to ask Dr. Tobias to address us, and then I'm going to ask Walufu to give us a parting conversation before we go to Q&A. So Dr. Tobias, over to you. Thank you.
Hello.
Go ahead, Dr. Tobias, we can hear you.
Oh, sorry. Thank you so much for this wonderful webinar, and I would like to echo the words that have been made clearly by Ms. Hadia. And before I speak, I would like to request my advisory council chair, who is present on the call, Professor Vinod Chandra Menon, to say a word. Then I'll speak briefly in 1 minute. Thank you so much for your time. Prof, please.
Thank you. Professor Menon, thank you.
Yes, thank you very much. It was actually extremely, complex challenges which were actually being brought up by the speakers. And I must compliment Dr. Pooney for raising these issues in terms of the complex challenges which children are facing in many African countries. And if you really look at the median age of many of the African countries, they're all below, most of the African countries are having the median age below 20. And that means that, the younger age group of the children can actually be an asset in terms of social change. And that is where Africa Rising and Africa 2063 and many such initiatives by Casey Foundation Africa and by Stellenbosch University and by APAM and many other like-minded institutions will actually be able to contribute. I understand that during the global pandemic, the child marriages actually went up in many countries around the world, and especially in Africa. In some of the countries, actually, the children were actually taken out of school and girls were married because of several issues, including poverty. So I think the point which was raised by Heidi about the education being a very positive influence on girls and boys and also among parents is something which we have seen. Women's education has been a very positive influence in terms of reduction of MMR, maternal mortality rate, and infant mortality rate in Kerala, in India, which has a very high social development report in statistics. So we have seen that women's education actually also helps in terms of providing a better understanding of social realities and also empower women and their children to also insist in terms of opportunities for more education, more access to employment, and income generation opportunities and things like that. And I think that is something which we should actually build on. So I was also thinking that the contribution of agencies and institutions like the African Alliance for Community Resilience, which was mentioned by Haider, is something which we need to really build on, because civil society and social capital is something which can actually help in making sure that children are protected and that their lives are actually the quality of lives are improved by substantial contributions by people, civil society and civic action. So I want to thank all the speakers and also Dr. Puni for anchoring these discussions in terms of making contributions from both UNICEF and African Union. The statistics and the data which is provided by Heidi are startling, actually. And I think governments should actually be forced to take a stand in terms of making sure that protection of girls and protection of children and prevention of child marriages must be made a legal, mandatory, policy level support, which should be improving the quality of lives of the children. Thank you very much. I really enjoyed this deliberations. Thank you.
Thank you, Professor Menon. Over to you, Dr. Tureas.
Thank you so much. To echo what Prof. Vinod has said, indeed, myself, I come from the Maasai community where early child marriage is predominant. It has been with us for decades now, where a girl at the age of 12 years is forced to get married to an old man. And in many African traditions, we've been fighting this for a very long time through policies and interventions in parliaments and also through advocacy in governments to ensure that our children are protected, especially the girl child. And listening to Hadia and Dr. Puni and the rest of the speakers who spoke earlier, it is important that we continue this conversation, not just to remain here, but push it even to be adopted by the African Union Commission and other regional blocs like the SADC, ECOWAS, EAC, through different policy interventions. And that's why for us from Africa International Policy Research Center, part of our interventions are keenly on ensuring that we protect humanity and without forgetting the children, especially the young girls and women who are victims of gender-based violence, and also generally now going further to intervene by urging the governments through the national assemblies who are policymakers to be able to table bills and pass them and urge the presidents to adopt into an act of parliament policies to be implemented as well to the grassroots to protect our children from these heinous acts that have been there for a very long time. To finish as well, it is an important conversation that we have had from today, and I hope that the partners, we inclusive who have planned this, the conversation should go on, even in social media platforms, engaging the young people, and maybe next time we need to consider to bring even those who went through this, the young girls who are now mothers of different children and who are also fighting this, to give their story. And rewriting the history is also good to help the future generations to learn from what has been happening and change for the better of the continent and our countries we live in. Thank you so much for the wonderful presentation, speakers, and we look forward to continue working together. Back to you, Dr. Pun.
Thank you, Dr. Tobias. I think before we go to the last segment of our program today, which is the Q&A session, shall we have Mr. Walufu Evans to close for us? Thank you. Walufu, over to you.
So much, Doctor. I have some issues with network, so I will keep my camera off. So I want to thank the participants for joining us to insight on how poverty and limited healthcare access fuel child marriage. So the panelists have shared strong research findings, real life experiences from the field, promising community-based strategies. Ending child marriages requires cross-sector collaborations, better health and access to education. Advocacy to change harmful social norms.
Hi, Walufu, just be aware we're having difficulty hearing you, at least on this on my side.
Yeah, it's been cutting off a lot. Yeah, Dr. Puni, I also cannot get what Walufu is saying, unfortunately.
Okay, so Walufu, can I suggest that maybe this important closing discourse that you want to share with us, you can put it in the chat, if that will work. And then we will try a little later. I just want to get to a few questions. Hadir, if you can look at some of those questions that we've had, I think there's very, very clear questions directed to you. So can I read one of them? And then maybe you can give them an answer.
Sure.
Go ahead. I think there's one that is very specifically just aimed at you or directed. So the question is, when Hadir talks about girls' agency, it resonated with me. We did a study in Ethiopia, which found no significant link between age at first marriage and psychosocial well-being, social capital and self-esteem, earlier child marriage, culturally supported. It was seen as desirable, leading to higher self-reported social capital and self-esteem. This contradicted existing literature, but underscored the need for girls to be aware of alternative life paths. Is there an answer that you'd like to give there?
Thank you, Dr. Puni. I really like this question, and I think I agree because again, some of the girls that I've spoken to, like they at age of 16 or 17, they favor the child the marriage path because there is constant repetition from their families about the alternative positive life path that they can get from being married rather than any other life path. So I totally agree that there needs to be more rigorous, context-driven alternatives when sharing with young girls during education curriculums. We cannot impose a like, yeah, you know what, like go finish your school and like go to work, and you know, because sometimes honestly in certain communities this is very like looked down upon. So we need to know what are the context driven for every community and to articulate and contextualize the life path that we talk to with every single, not with every single, but with every single community when we talk about what are alternatives for the girls. And I think also that comes first to that is engaging the religious leaders and the society leaders. From what I've seen in Egypt, sometimes the grandmother has more power than the father and the mother. So I think we need to engage elderly in every conversation, in every advocacy campaign that we engage with as well.
Thank you,
Hopefully
Hadiya.
that answers. Yeah, thank you.
Thank you. We have a very good question from Robert. It says, which policies have been most effective in reducing child marriages in impoverished communities? In other words, Robert is asking for an evidence-based answer. Both Teboho as well as Hadiya, you may want to answer this. Thanks. Over.
Debo, would you like to go? I feel like I've been talking too much.
No worries. I think I can take this one. But I thought we're going to take a number of questions all at once, just in the interest of time. Sorry. I think in at least a case where I've been directly involved in SADC, as I'd mentioned, the SADC model law on child marriage. And this one is an interesting, specific one because the traditional leaders were involved in the development of the document. So it was not a foreign document to them that was imposed. I think the experience is sometimes they feel like we're imposing things on them and hence they push back. But once they're involved, and that was done through the leadership of Dr. Nyarazai, as I mentioned before, who was the former Goodwill Ambassador to the African Union campaign on ending child marriage. So those kind of engagements and the model law, like it was a long process of engagement and then directly leading it up to them as saying, this is your document, you need to own up to it and use it. And working with also the likes of Chief Teresa as well. I think traditional leaders and some religious leaders, the engagement, the challenge mostly is when it comes to politicians. Religious leaders and traditional leaders, in most cases, once they're engaged and they understand where the issues lie, and we tell them or engage them on how they can best support and change the narrative, they're forthcoming. Politicians is a different story. Hadiya mentioned all these commitments that I briefly highlighted in my conversation, the Maputo Protocol, and etc., etc. They are beautiful, they are clear, but our leaders are not utilizing that, and that is where the challenge is. And currently, we are seeing something. I think maybe in SADC, through the process of the SADC strategy, we saw civil society and young people being brought into the process, and it was an open process, and we're still continuing to engage even in the reporting process at country level, even at regional level. But it's a different story when we are talking about the EAC bill. It's still stalling. Very progressive document, but why is it stalling? Language. So I think one of the comments was about, I think even Prof. Vinod mentioned that the leaders in countries also, we need to tell them this is what needs to happen instead of asking. As thought leaders, as organization, the UN partners, we can come up with these solutions and also try to engage them. But if the citizens themselves are not, well, force may be a bit harsh, but if we are not holding them accountable, then the change will not, we will not see it. All these processes, the global, the continental ones, they're beautiful, they're engaged, they're well aware of them. We're aware of the challenges. We're seeing what is happening currently in DRC. We saw what happened in Mozambique and Malawi. every day we're seeing, and I think in the comments also someone mentioned some cases in Eastern Cape and South Africa. We see them every day in our communities, but the problem is at the leadership stage, where you see the resistance and the push, like, yeah, we are westernized, we're pushing agendas, which is a challenge, because honestly, we have to learn from somewhere to bring about the change that we want and we see in our communities. And I think I love the idea of also the collaborations and engagements and continuing this conversation beyond this webinar, which is also very important. And I think someone, Dr. Mushosho, asked about mentorship, and I think this is one of the platforms and processes where we learn from each other, we build each other and empower. You might have some information that we don't have that is mentioned, and in comment, I think you said you want to work in Lesotho. I think that is something that personally I can, as somebody who's from Lesotho, I can support with. So yeah, I think there was the other comment, sharing of slides and the likes, and I think Hadia, somebody talked about you mentioning boys, that most of the time we leave the boys behind. I think it's not that we leave, it's just maybe I'll call it we overemphasize. But currently, we've realized our mistakes, especially in civil society, that we always we have this acronym AGYW. So now we make sure that it's not just AGYW, it is also ABYM. So we are correcting also our wrongs. We realize in our conversations and advocacy, sometimes we get taken over by a certain topic, and then we, not by design, leave the others behind, but the intention is to make sure that we leave no one behind and we engage and involve. And parent to child communication, I think that is another one, sorry, that was raised in the comment. Parent to child communication, I think, is still another gap that we're seeing. It's difficult to get parents to the table, so we need to strengthen that as well. Some community-based organizations are trying to have those conversations with parents, involving parents, so that these conversations or topics don't appear as foreign, where we can gather young people, but then we leave their parents out of the conversations, especially around comprehensive sexuality education. So yeah, I think if there's any other question I forgot, that's it from me. Dr.
Thank you so much, Teboho. I see your comments around the fact that there have been bold leadership strides that have been made. There are some evidence-based best practices that we can harness. We don't have to reinvent the wheel. I think this call for active citizenry, it is being echoed by some of the comments that we're getting. Prof. Manan is also suggesting the same thing, where we have a follow-up conversation around what are the best practices that we can actually build on. I do want to say that, you know, I have seen that in one generation, things can change. My own personal story, I'm encouraged by Dr. Tobias that is sharing some of his own personal story. I can tell you that my grandmother had 13 children, 16 actually, 16 children, and lost 3 children during the labor and delivery process, had 13 children who survived, and in the next generation, the average size of family is 2. So I think in one generation, things can change, but there has to be a catalyst for the change. And perhaps all of the people that are here right now are ready to say that actually we have the best practices, we have the bold leaders, as Teboho has told us. And Hadira has given us the legal framework in which to do this. So I think everything we need is right here. We just have to go out there and be active citizens in our spheres of influence. I do want to take one call, one person. It's Thompson Falade. You've had your hand up for a very long time. I do want to see you put it down. So you have the mic. Over.
Hello, everybody. I say good afternoon from Nigeria. My name is Kolade Thompson. This point we are discussing here let me say I salute or I extend my warmest greeting to all the speakers. The point here is so touching, and it has been a major problem in this part of the world to an extent that severally, I personally will sit back and I will think deeply. Unfortunately, there have never been any solution. Even what others have been suggesting here, called policies. I study public administration, and I know it is very easy. The easiest part of policy is making it. But the crucial part of policies is to make it effective. But unfortunately, in this side of the world, we, the makers of the policies, are the major breakers of the policies in most cases, especially when we are fighting it to favor us. But we can't say we won't make policy anymore. We cannot say because of this, we leave the society untouched. No. I have an opinion. I think it is high time we called ourselves to order, all the necessary bodies. But one thing has always been scaring me, the so-called United Nations that remains a toothless body forever. This will have been a discipline or a body of, a disciplinary body for the whole world. There have been a lot of mistakes. If United Nations can encourage IMF to sponsor a nation, and you say you don't care about how such nations spend such huge amount of money, which is the genesis of corruption in Africa, then it is better you stop sponsoring us. Let us know how it is hard or how hard it is to make money so that we can value the spending. What caused all this mostly in Africa is corruption, poor governance. They begat poverty. They begat this issue of ineducation that has covered the whole sphere. I am a Nigerian. As I speak to you today, education is blinking at 35% all over the society. I repeat myself. I can prove it anywhere in the world. And the 35 are those who had made up their mind that, no, come what may, I am going to be educated. I am going for it. You see this issue of 419, social crime, cyber crime, Yahoo, all sort of, has covered the whole world. And sincerely speaking, this is eating us so deep. Now, I would have suggested, is it possible with the help of this body and other NGOs, APAM, USAID, UNICEF, other humanitarian bodies, to stand up and ensure a non-nepotic law policies that cares for no one, but cares for the purpose it was meant for? I tag this as war against child marriage in Africa. If care is not taken, the Western world should be expecting terrible things that will be happening. Do you know why? The Western world will not stop saving the Africa, and the Africa will not stop killing themselves. We are having huge problem. I anchor myself here. God bless you all.
Thank you very much. I think you've given us, Kolade, a lot of food for thought. You have, I think, gone to the root cause of many of these issues. Certainly, you haven't been able to get to all of the questions and answers, but it does seem to dovetail very nicely with what we've already said. Walufu, if your connection permits, you can close us, and please give us a sense of the questions and whether they'll be the answers to them will be distributed to the participants today. And next steps. Thank you. Over to you, Walufu. Thank you.
Thank you so much for this opportunity again. I had some issues with network. I want to take this chance to thank all the panelists and the participants for joining us today for this session. Your insights and contribution is very important for the progress. So child marriage remains a problem. And from the previous speaker, he has made it clear, and other speakers also made it clear. I also was following through some chats, and there's a speaker who mentioned that whatever has been spoken, he has had. How do we actualize what we have aired out? Speakers have shared the insights from the field, research, and practical solutions for us to address the challenge of child marriage. Child marriage affects around 7 SDGs. You cannot achieve them when child marriage is still a problem. When I did a study on child marriage in Uganda, I realized things that I did not even know because I wanted to enter into something that I understand better. So let this session not just end here. We need to push the force forward. Because if we don't do it, then we risk the coming generation. They will ask us, what did you do when you were there? Or when you had power, when you had that office, what did you do? Speakers have talked about corruption. I acknowledge that there is a lot of corruption in Africa. And it is corruption that hinders the implementation of most of these projects. How then do we address this, having known that corruption is a problem? Shall we continue to cry that corruption is a problem? Why can't you get these people to book, people who are corrupt? Assuming a project received funding and most of the money is used for attending events. This is what I see in Uganda, and I've also seen it in African countries. A project will receive funding of $100,000. 40% of that money is used on attending events. Only 10% reaches the beneficiaries. What are we doing? Where are we heading to? Where is the reach the beneficiaries? The rest is consumed in the ways we don't know. Then we shall continue to make research and ask and continue to dig into child marriage and do what and do what. So if corruption is a problem, we have to address it. If the governments are not responding to the calls of child marriage, we have to address that. We need to hold these governments accountable. It is us who put these governments into power. They must account to us on what they are doing, not us to account to them. If we put a leader in power, a leader should account to the subjects, This is what I've been doing. This is what I've done. So how do we get this force moving forward to ensure that we actually address child marriage? When Case Foundation, as I conclude, when I was starting Case Foundation, actually the call, what led to the formation of Case Foundation was a younger lady who got pregnant at an age of 13. And when I was trying to interact with her, she told me that life is hard. I'm pregnant and life is hard. I don't have anything to do other than aborting. She wanted to go for abortion. I encouraged her not to take an abortion. Told her there is life after. Even you gave birth, you can still make it. But the lady told me life is hard, So how do we then come up with how do we then task the government to ensure that they look into this issue? Poverty, without fighting child marriage, I don't know how you will achieve poverty and there is high rate of child marriage, because we find out that most of the people who are child marriage. So recognizing that child marriage is intergenerational, it keeps people in that cycle of poverty. We need to break that cycle. So this discussion may not just end here. Let us continue with the talks and explore possible ways Thank you so much to the partners and to our speakers. I will head back to the moderator to finally close the session. Thank you, and I wish you good luck in all your endeavors.
Thank you, ladies and gentlemen, for your patience, for the technical difficulties we had at the beginning. And each of our speakers had so much to contribute and teach us today. I think we're leaving this session very hopeful. What people have said to us is that there is an opportunity, and there's an opportunity for African solutions. I think that's what you are suggesting here, African solutions for African progress. So with that, I just want to say thank you to the organizers and the various organizations that found it necessary to bring this kind of a platform together. Thank you very much for your time, and for the participants, for your patience. I really appreciate it. All the best. Thank you very much, and we will see you in the next event. Take care. Bye-bye.
Bye. Thank you.